The wonderful news about vertigo is that most of it is 100% curable if diagnosed appropriately. It's 100% curable, yes, within a 5-minute head procedure if diagnosed appropriately. This is why it's so critical who you go to for this assessment. Remember, in the beginning of my book, I talk about the 7 most important steps to good care, and the second step was assessment. So for vertigo, remember, it's not a diagnosis, it's a symptom of something else. So you have to find out where it's coming from. So an extensive test battery is done all the way up the vestibular pathway, including to the brain, and we know what's going on by eye movements, and we can rule in or out the inner ear, which is hugely important, because if we rule it out, then there's something else going on elsewhere, and it's usually more centrally located in the brain, and a neurologist can take it from there. But ruling in the inner ear is, most of those vertigo issues are curable. Now, why do they get misdiagnosed? Why do patients suffer for so long? Because the route currently is when a patient goes into their primary care physician or their ENT for vertigo, they get sent, most cases, directly to physical therapy. Physical therapy is great. I have several dear colleagues that are physical therapists, and they will tell you they are a treating profession. They treat patients who have knee replacement surgery, shoulder. They're doing physical therapy. They're treating these types of patients. So when a patient with vertigo gets sent to them, they are treating the vertigo, but it hasn't been diagnosed yet. It's just a symptom of something. We have to find out where it's coming from. And yes, there are physical therapists that are highly trained in vestibular issues. That's very, very, very rare. So I'm going to say that you really still want to stick with an audiologist who has been trained and is passionate about the vestibular area of the inner ear, and get a proper diagnosis, and then go to treatment. In my clinics, we treat, diagnose, manage those patients well, and like I said, it's usually they're cured within 1 visit. Rarely do they need a second visit when it's coming from the crystals getting dislodged. Other causes of vertigo can be medication related, cardiovascular disease, all these things that we look at in a good assessment. And I want to just mention, because we had so many patients that would come in on long-term medication because of dizziness. Remember, dizziness is a symptom, not a diagnosis. And yet people were coming in taking long-term medication for vertigo. And this is not good. One of the main medications was meclizine. Meclizine is a vestibular numbing agent. And yes, while it may help in the moment to relieve the vertigo, which may be critical for patients who need it for a short period of time, it is not good long term. You're more likely to fall because it's numbing the vestibular organ. It's not allowing information to get to the brain about balance, and that is not good. Remember, we talked in an earlier video about how our brain makes decisions about balance, and the vestibular organ is the most important part of that, I would argue. So long-term medication to treat dizziness. Ask more questions. Maybe these patients didn't understand fully why they were taking it, but many of them did. So if this is you or a loved one and you're medicating because of dizziness, I'm going to strongly recommend a new assessment, a new diagnostic test battery from someone that is passionate about it, an audiologist in your area that's doing vestibular diagnostic testing and treatment. All right, thank you so much. I hope this helps you. I'm very passionate about this, and my goal is to help you and your loved ones live the best life possible. So here's to your healthy hearing, balanced healthcare. I love you so much. Have a great day.